Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
Welcome to episode 157 of the Everything Medicare Podcast, folks. I am here. I'm alive. I survived. As you may have known, I've been out with the flu. We've missed 2 of the past 3 episodes, and the only reason why we brought you an episode on Saturday was because we had one pre-recorded, okay? I did not suddenly get better and then get sick again, so please understand that. We got a lot of comments, a lot of emails, wondering how I was able to come back and do a show for you on Saturday, but then Monday I was sick again. I never stopped being sick, folks. I was sick for the entire Tuesday through Tuesday schedule, and I apologize. We were going to bring you a really awesome interview on Wednesday. We weren't able to do so because of me being sick. And as you might be able to hear in my voice, I'm still a little bit under the weather. I've been cleared by the doctor to be back at work. I've been cleared by the doctor to be around my family, pick up my child, my 9-month-old daughter. And I'm not contagious. However, I still have a little bit of raspiness in my throat, in my voice. And you're going to have to deal with that today. But I was not going to keep another episode from you. So I do sincerely appreciate your patience, your understanding, and all of your kind wishes for me to get better. No, I did not have the coronavirus, for those of you who might have been wondering. But I did have a pretty bad flu, and it was a pretty rough week for me. For any of you that know me well, or anybody that might have been listening to this podcast for some time, you know that I do not miss shows. I do not miss podcast episodes, and I don't miss work, okay? I show up day after day, day in and day out, and for me to even miss 2 episodes was something that killed me, and I did not want to do it. I was very hesitant to do it, and I wouldn't have done it unless I had to, so I really appreciate your patience. This is the Everything Medicare Podcast. If this is your first time listening, every single week, we bring you 3 podcast episodes where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement, folks. Thank you so much for being with me here today. This show has never been about politics. It's never been meant to discuss politics in any shape or form, in any fashion, I should have you. Now, that being said, sometimes politics and the topic of the show, and that's Medicare, overlap. And sometimes I'm forced to talk about it. That's why we've done episodes in the past about Medicare for All and things like that are going on that aren't even necessarily a thing that's going to potentially happen. I mean, you never know, I suppose. But it's something that we needed to discuss because it had to do with Medicare, our bottom line, okay? And today, folks, we're going to be bringing you a topic that's been in the news. Now, it's not exactly a news story. The first time it came on my radar was in November of 2019, but I thought it was appropriately timed to where we had some new information and some new updates that I wanted to bring it to you and kind of share my opinion and my perspective. So to start off with that, I wanted to share some information from some articles that can kind of put into perspective what we're going to be talking about today, and that is the White House, the Trump administration. Whether you love this administration or whether you hate this administration, I really could care less. That's not what we're here to talk about today. But I am here to tell you something that's going on between the current White House administration, the current presidential White House, and the hospital organizations and the hospital lobbyists. They're kind of butting heads right now. And it looks like it could potentially get pretty ugly. So for those of you who may have heard, a lot of you maybe have heard, I'll read you the title of this first article by the New York Times. All right. This article is titled, "To Lower Costs, Trump to Force Hospitals to Reveal Price of Care. A proposed federal rule would make hospitals list the prices they negotiate with insurers, allowing consumers to seek better deals for care." Okay. So I'll read you a little bit about this article, and then I'll kind of break down into layman's terms what it's talking about. Now, this article came out back in November 15th of 2019. So this isn't exactly new news, but it kind of puts into perspective what is going on. The article starts out like this. The Trump administration on Friday announced it would begin forcing hospitals to publicly disclose the discounted prices they negotiate with insurance companies, a potentially bold move to help people shop for better deals on a range of medical services, from hip replacements to brain scans. For decades, hospitals, insurance companies, lobbyists, and special interests have hidden prices from consumers so they could drive up costs for you, and you had no idea what was happening, President Trump said Friday afternoon in the White House's Roosevelt Room. You'd get bills that were unbelievable, and you'd have no idea why. Patients, he said, have been ripped off for years. The federal rule, which would not take effect until 2021, so we're in 2020 right now, currently in February, so we'd have just a little bit under a year to go before this takes effect. But it continues to say the federal rule, which would not take effect until 2021, is part of a broader push by Trump officials to make healthcare markets more transparent for patients. The administration also unveiled a proposed rule to require insurers to allow patients to get advanced estimates of their out-of-pocket costs before they see a doctor or go to a hospital. Mr. Trump rolled out the initiative personally, providing some counter-programming to the second day of impeachment hearings. Now, this was back when the impeachment hearings were going on, so take that with a grain of salt, while showing his willingness to take on powerful interest groups like hospitals and insurers. So, what did we get from all of that? Essentially, if you've lived in this country for any amount of time, which I take it a majority of our audience today has, and if you haven't, I don't think it's too much of a foreign concept to say that our hospital system is incredibly whacked. I did an episode where I kind of just talked about my own experience taking my daughter to the emergency room some time ago in the last 6 months. And it's just one of those things where you never know what you're going to be paying, whether you have insurance or whether you don't have insurance. Now, if you have something like a Medicare supplement, you should be able to walk out with the expectation that you're going to have little to no out of pocket. Or if you have an Advantage plan, you should have a set copay. But let's say, someone has a group plan, or someone has an Affordable Care Act plan, or an Obamacare plan, or a catastrophic coverage plan, or maybe they just don't have insurance at all. Maybe they're just paying out of pocket. Well, do people exactly know what they're going to be paying when they step through those hospital doors? Absolutely not. The hospitals will not tell you. The doctor's offices will not tell you. Do they know how much it would cost? Well, I think the only person that can answer that is someone on the inside, and I'm not. But I think it's reasonable to say that, at least for a majority of these test cost procedures, that they know how much it's going to cost. But legally speaking, they're not required to tell you. So what do I think about this? Well, I'm going to tell you what that is after I talk about the second part of this. Article that came out in December of 2019 on CNN Politics. Now, I'm not political. I'm just finding articles where I can find them that kind of disclose some of this information a little bit, okay? If I found the article on Fox, I would have read it on Fox. I'm not pro CNN. I'm not pro Fox, so please don't jump all over me. But basically, this article was put out by a Tammy Luby. I'm not even sure if I said that right. But it was put out December 4th, 2019, that said, hospitals sue Trump administration over price disclosure rule. And when I saw this, I was like, oh, this is getting juicy. The article starts off to go something like this. A coalition of major hospital groups filed a lawsuit Wednesday to stop the Trump administration from requiring them to disclose the prices they privately negotiate with insurers. The move comes less than 3 weeks after the administration issued a final price transparency rule that officials say will help reduce the cost of healthcare. One of the President Donald Trump's main promises as he heads into his 2020 campaign. The hospital groups contend that the Centers for Medicare and Medicaid Services overstepped its authority in compelling hospitals to publicize these rates. Plus, they argue a provision violates the First Amendment by mandating they reveal the rates in a manner that will confuse patients and undeniably burden hospitals. CMS's final rule fails to offer patients easy to understand information regarding their out-of-pocket obligations for care, so we feel obligated to contest the regulation, said Chip Kahn, chief executive of the Federation of American Hospitals, which represents investor-owned hospitals. We contend the agency exceeded its authority and should go back to the drawing board. Whoa, those are some pretty strong words. The article continues to say, the Federation filed the suit along with the American Hospital Association, the Association of American Medical Colleges, and the Children's Hospital Association, as well as 3 hospitals in the U.S. District Court for the District of Columbia. The rule, which stems from an executive order Trump issued this summer, requires hospitals to make public, starting in 2021, the rates they negotiate with insurers and the amounts they are willing to accept in cash for an item of service. In addition, they must provide this information in an online, searchable way for 300 common services, such as x-rays, outpatient visits, deliveries, lab tests. Hospitals that don't comply will face a civil penalty of up to $300 a day. When he announced the regulation last month, Health and Human Services Secretary Alex Azar said he believes it will survive any legal challenges from hospitals. Hospitals should be ashamed that they aren't willing to provide American patients the cost of the services before they purchase it. Caitlin Oakley, an HHS spokeswoman, said Wednesday. So what does this mean, folks? And what do I think about it? Well, before I answer that for you, I'm sorry, but I have to take a break. I'll be back in segment 2, and I'll tell you exactly my thoughts on this, what it means for you, and what are the chances that it might not pass. Don't go anywhere. We'll be right back. Welcome back, everybody. Thanks so much for sticking with me through that break. And thanks for joining me on episode 157 after a couple of episodes that I was not able to join you and do a show. And it sickens me that I wasn't able to. And I appreciate your patience. I appreciate everyone's support. And I appreciate you sticking with me through this episode, despite the fact that I sound like half the man that I normally am. Still getting over this cough. Doctor says that I'll probably have the cough for maybe another couple of weeks, and my voice should improve day by day. So hopefully by the time we bring you Saturday's episode, my voice is completely recovered. We'll see though. So what do I think about this? I think that it's absolutely unbelievably ridiculous that in the United States of America that you can get any type of service done and not know what it's going to cost you ahead of time. What else can you possibly get done of any kind, excuse me, and not know what it's going to cost you ahead of time? If I go to my mechanic to get my car fixed and I don't exactly know what's going wrong, let's say there's a noise underneath the hood. I'm not exactly a very car savvy guy, so I take it to my mechanic. My mechanic takes a look at it. My mechanic comes in, tells me what the problem is, and they said it's probably going to cost $600, Mr. Brindle. I then have the option to say, yes, go for it, fix it. Or, no, I don't have $600. I'm going to take my chances. Right? If I go to dinner, if I take my wife to dinner and we go to a fancy restaurant, I'm allowed to look at the menu and see their soups are $30 and that their steaks are $100. And if I'm not okay paying those prices, I am obligated to get up and walk out if I don't want to eat there. If I do anything in the United States of America, I cannot think of anything that you are not told what it's going to cost up front. And I mean absolutely anything. The only thing that it seems like is subjective to this rule, and if I'm missing something, I encourage you to call me out on it. I encourage you to correct me on it. If there's something that I'm not thinking of as far as how much it's going to cost you, other than healthcare, what is it? Education? Schooling? No, I think you're pretty much told up front about those things. Right? If I order a batch of pens, let's say, I keep a dozen or so pens on my desk every day. I'm going to know what those pens are going to cost. If I order more business cards for my company, I am always told what's going to cost before I order, and I'll be told how much it costs for 10,000, 20,000, 30,000, or maybe just 1,000 for making a smaller order. It's shocking that this is such an issue that medical professionals are fighting. And if you ask me, folks, do I think that socialized medicine is the answer? Everything controlled by the government? I do not. I've made that very clear on this platform. But do I think that our system is fine the way that it is? Absolutely freaking not. I think that there are things that need to be corrected, and I actually support this. I think that the attempts made by the hospital associations show their true colors, in my opinion. I think they are some of the snakiest, weaselest organizations, the people that run these hospitals. Now, don't get me wrong. Does that mean every single hospital out there is bad? No, I'm not saying that. So if you work at a hospital or you run a hospital and you're listening to this, don't misinterpret my words. But I think we can all agree that there are people that run these particular hospitals that are not in it for the good reasons, that have no shred of decency. The fact that they're suing the government to try to prevent them from disclosing costs before they give them the service tells me everything I need to know about these people. And that's that they're slimy, they're slippery, and they've been getting away with murder for a long time and they don't want it to stop. That's what I think. Could it confuse some people, like they said? Possibly. Does it confuse people now? Yeah! Yes, it does confuse people now. So what changes is that going to make? I'll ask you. The short answer is none. People are going to be confused either way. Our medical system, our healthcare system is confusing for many, as it is. The fact that you should be able to go on and, on a computer and see exactly how much something's going to cost you at a particular hospital, I think, if anything, that would take more confusion out of the equation. Call me crazy. My job, folks, is not to stand up for the healthcare system. My job is to not stand up for the insurance industry. My job is to help you navigate it as well as you possibly can. There's still a lot of time left. Could the lobbyists get their way? I mean, who knows? At this point, it seems like the bill's going to happen. But we don't know exactly what's going to happen. These hospital chains are very powerful. These lobbyists are very powerful. And I think it's clear to any of us that are paying attention that they're as crooked as crooked can be. I, for one, hope that this passes. Regardless of how you feel about the president, And I'm not saying I do or don't support the president. I'm not making my stance clear, and I'm not going to do so. But on this particular issue, I think it's something that needs to be done for not just for you and not just for me, but for your grandchildren, my children's children, your grandchildren's children. Because I think any of us that have ever gone to a hospital and found out they were billed $500 for an aspirin feels like they were incredibly taken advantage of. Or maybe they asked at the desk, they said, "Can you at least tell me how much this might cost me if I don't get any tests done?" They're like, "Nope, we're not legally obliged to tell you that, or we're not legally able to tell you that," or whatever other kinds of horse what they tell you. I am not a fan of anything other than transparency. I'm not to say that I'm the most educated guy. I'm not to say that I'm the most, articulate person, although I think I'm fairly articulate. And I'm not to say that I'm the most, classy guy or whatever you want to call me. But I am a fan of transparency. The show is all about transparency. Me talking about my life, how it translates, how it ties together to the topic in hand every week. You going through my journey with me of life. Anybody that's been listening to this has seen me go through a lot, through our company building, through growing our staff, through having my child, through me being sick the last week. You all know. Our audience that listens week in and week out knows. And so you know that I'm a fan of transparency, and I can never get behind an organization like a hospital getting away with hiding their fees from people and running every test they can, racking up the bill as much as they can, and then saying, "Thank you, sir, very much. That'll be X amount of dollars. Figure out a way to pay for it, or we're coming after you. We're sending you to collections. We're going to ruin your credit. We're going to ruin your life." Are there assistance programs? Sure. Okay, I get it. I already hear people saying that. But I will repeat what I had to say earlier. What other service can you get in the United States of America where they not only do they not have to tell you what it's going to cost ahead of time, but they will refuse to tell you, and legally they can do so. You won't find a hospital in the United States today that will tell you ahead of time how much it will cost for you to be there for a particular service. And that's unbelievably crazy if you ask me. I'm all for transparency. I believe this brings transparency. Don't go anywhere. I have some final thoughts, and I will bring them to you after we take one more break. Don't go anywhere. I'll be right back. Welcome back, everybody. Thanks so much for sticking with me. My final thoughts on this, folks, is if this episode offended anybody that might have been listening, I'm sorry, but I'm not ever going to come on this platform and sit behind this microphone and tell you anything other than the way I see things. Am I right about everything? I don't think so. When it comes about Medicare, I'm probably right about 99.9% of things, though. Although this isn't a Medicare topic. And this is something I'm not an expert on, and that's healthcare. Probably know more than the average bear because I deal with healthcare on a daily basis almost, dealing with claims and things like that. But it's something that I wanted to just talk about, share my thoughts about, and I thought it'd be an interesting episode for everybody. Not trying to offend, just trying to bring my perspective out into the open for you. And just wanted to let you folks know this coming I'm not exactly sure when it's going to air, so I'm not going to tell you exactly when it is. But this week, later on this week, I'm going to be doing a guest interview on another show, on another podcast. And once that comes out, I will let you know when it's airing, where you can find it, and so on and so forth. So please make sure to stay tuned for that. You're not going to want to miss my guest appearance. I'm very, very excited about it. I think it's going to be great. I'm going to be going on to talk about The Insurance Funnel, my newest book that just came out in the last week or so. And if you have not picked up your copy of The Insurance Funnel, go to Amazon, The Insurance Funnel, 9 simple tests, every insurance policy must pass before they're worthy of purchase. It's a beautiful blue book, funnel on it. You can equivalent it to any single type of policy, and it can save you more money than you can imagine for $15. Go check out The Insurance Funnel, pick it up. I highly encourage you to do so. It's my newest pride and joy. It's my gift to the insurance industry. It's my formula in a way that I've come up with. Excuse me, still a little sick. It's my formula that I've come up with to determine whether any plan is good for you or not. And you can use it for anything, like I said. Thanks so much, folks, for sticking with me. And appreciate your patience again, and all of your love and all of your support with me being sick and me being out. It's hard for me to be sick. I don't know what to do with myself. Can't talk, can't eat, can't really move, can't really do anything. And I'm a busy body. I love to move around. I love to do things, and I love to feel proactive. So it's very hard on me. But I appreciate all your support, your patience. We will be back with an episode on Saturday. You're not going to want to miss it. Thank you so much for tuning in. Have a great rest of your day.